COVID vaccination.
Yung food court na ito, open na rin bukas.
The whole community will be there.
Na nakatulong sa pagbaba ng mga kaso, ito ang bakuna.
The Philippine College of Physicians invites you to its 25th Mid-Year Convention, hosted by the Central Luzon chapter. In this era of integrating virtual and face-to-face methods, learn on how we can move forward without compromising our practice of medicine. Join us in the 25th Mid-Year Face-to-Face with limited Zoom link convention. Let us learn more practical approaches to relevant and diverse issues in internal medicine with a renewed perspective. Interesting topics await you. On November 18 to 19, 2022. Save the date. See you at the premier convention facility in Central Luzon, Subic Bay Freeport Zone at the Subic Bay Exhibition and Convention Center. Don't be left out. Register now. See you there.
President Rodrigo Duterte welcomed the arrival of Sinovac.
Dumami pa ang mga Pilipinong gustong magpabakuna. Barangada ng COVID vaccination.
Yung food court na ito, open na rin bukas.
The whole community will be there.
Na nakatulong sa pagbaba ng mga kaso, ito ang bakuna.
The Philippine College of Physicians invites you to its 25th Mid-Year Convention, hosted by the Central Luzon chapter. In this era of integrating virtual and face-to-face methods, learn on how we can move forward without compromising our practice of medicine. Join us in the 25th Mid-Year Face-to-Face with limited Zoom link convention. Let us learn more practical approaches to relevant and diverse issues in internal medicine with a renewed perspective. Interesting topics await you. On November 18 to 19, 2022. Save the date. See you at the premier convention facility in Central Luzon, Subic Bay Freeport Zone at the Subic Bay Exhibition and Convention Center. Don't be left out. Register now. See you there.
President Rodrigo Duterte welcomed the arrival of Sinovac.
Dumami pa ang mga Pilipinong gustong magpabakuna. Barangada ng COVID vaccination.
Yung food court na ito, open na rin bukas.
The whole community will be there.
Na nakatulong sa pagbaba ng mga kaso, ito ang bakuna.
Philippine College of Physicians invites you to its 25th Mid-Year Convention, hosted by the Central Luzon chapter. In this era of integrating virtual and face-to-face methods, learn on how we can move forward without compromising our practice of medicine. Join us in the 25th Mid-Year Face-to-Face with limited Zoom link convention. Let us learn more practical approaches to relevant and diverse issues in internal medicine with a renewed perspective. Interesting topics await you. On November 18 to 19, 2022. Save the date. See you at the premier convention facility in Central Luzon, Subic Bay Freeport Zone at the Subic Bay Exhibition and Convention Center. Don't be left out. Register now. See you there.
President Rodrigo Duterte welcomed the arrival of Sinovac.
Dumami pa ang mga Pilipinong gustong magpabakuna.
Barangada ng COVID vaccination.
Yung food court na ito, open na rin bukas.
The whole community will be there.
Na nakatulong sa pagbaba ng mga kaso, ito ang bakuna.
The Philippine College of Physicians invites you to its 25th Mid-Year Convention, hosted by the Central Luzon chapter. In this era of integrating virtual and face-to-face methods, learn on how we can move forward without compromising our practice of medicine. Join us in the 25th Mid-Year Face-to-Face with limited Zoom link convention. Let us learn more practical approaches to relevant and diverse issues in internal medicine with a renewed perspective. Interesting topics await you. On November 18 to 19, 2022. Save the date. See you at the premier convention facility in Central Luzon, Subic Bay Freeport Zone at the Subic Bay Exhibition and Convention Center. Don't be left out. Register now. See you there.
President Rodrigo Duterte welcomed the arrival of Sinovac.
Dumami pa ang mga Pilipinong gustong magpabakuna.
Barangada ng COVID vaccination.
Yung food court na ito, open na rin bukas.
The whole community will be there.
Na nakatulong sa pagbaba ng mga kaso, ito ang bakuna.
The Philippine College of Physicians invites you to its 25th Mid-Year Convention, hosted by the Central Luzon chapter. In this era of integrating virtual and face-to-face methods, learn on how we can move forward without compromising our practice of medicine. Join us in the 25th Mid-Year Face-to-Face with limited Zoom link convention. Let us learn more practical approaches to relevant and diverse issues in internal medicine with a renewed perspective. Interesting topics await you. On November 18 to 19, 2022. Save the date. See you at the premier convention facility in Central Luzon, Subic Bay Freeport Zone at the Subic Bay Exhibition and Convention Center. Don't be left out. Register now. See you there.
The Philippine College of Physicians, through the Committee on Media Communication and Health Forum, presents its bi-monthly lay forum to promote the advocacies and mission of the college and its component and affiliate societies. An avenue of accurate and up-to-date conversations with the media and the general public, with timely and diverse topics covering vital public health and medical information, straight from the experts. In a platform that is convenient, accessible, and highly engaging. Welcome to the PCP Health Forum.
Since the discovery of SARS-CoV-2 virus from Wuhan, China in 2019, there have been different variants that have caused surges in a number of cases over time. These variants have different traits that vary in terms of transmissibility and virulence. And there are clinical implications in terms of our antiviral armamentarium and vaccines. As we are going through another rise in number of cases with Omicron subvariants, it is but timely to have an update on this topic. I am Dr. Guinevere D. Agra, your moderator for today's PCP Health Forum, aptly entitled COVID-19 Positive Again, Variants and Vaccination. But first, let's call on a member of our distinguished Board of Regents, Dr. Rodney Jimenez.
Ay, magandang umaga, colleagues at mga kapatid sa PCP, friends from the media at mga kababayan. On behalf of the PCP Board of Regents and the Executive Committee, I'd like to welcome you to our PCP Health Forum. The topic is still, again, as mentioned by Dr. Gwen, COVID-19, positive variants and vaccination, to be delivered by Dr. Nina Berba, and of course, to be moderated by Dr. Gwen. Please listen to our speakers and the discussion, and then help us disseminate facts, not fake news. With that, enjoy learning and good day.
Thank you, Dr. Jimenez. Talagang we cannot underemphasize the importance of facts and not fake news in this era of misinformation. And we are so honored to have our speaker today. She's actually also a member of the Board of Regents of the Philippine College of Physicians. And she's also an incumbent member of the PISMID board. She's a professor of the University of the Philippines, Philippine General Hospital. She's also chair of the Hospital Infection Control Unit of the PGH, a member of the COVID Crisis Committee of the PGH, and a medical specialist 3 at the PGH. Let us all welcome Dr. Regina Berba, Master of Science also, FPCP and FPISMID.
Hi, good morning po everybody. So let me share my screen. Magandang umaga po sa inyong lahat, and I'm really very happy to be here again with you. So last week pinag-usapan natin yung dengue. Ngayon let's talk about COVID-19, and we entitled this COVID-19 Plus to just emphasize that this is really an update on the variants of SARS-CoV-2 and about vaccination. I'm also a member of the Committee on Media Communications. So the outline of this talk would be what's new with the variants of concern, at saka some updates on are vaccines effective, are vaccines safe, and I'll talk a little bit about our local vaccine effectiveness trial here in the Philippines and run through some of the frequently asked questions that continue to be asked of many of us in the field of COVID-19 care. So as of yesterday, 8/8 kahapon, The COVID-19 has affected almost every aspect of our lives. Imagine a staggering amount of 581 million confirmed cases globally at saka more than 6 million deaths across the world. So it has really changed many of the things we've been doing all this time. In the Philippines, we've had more than 3.8 million confirmed cases. Siguro nga at this time, baka a little bit underestimate yan kasi hindi na tayo na PCR, di ba? Most of us will just go for antigen testing and actually never report yet. So there's a chance na there's more cases than the 3.8 in our DOH dashboard. And this has led to almost more than 16,000 deaths in our country. So, let's go to the update on the Omicron. So, sometimes very convoluted na yung vocabulary ng variants of concern. And there was this Twitter user who said, what? Omicron what? Kasi di ba panay natin naririnig sa news, there's a new variant, there's a new number in Greek. And sometimes it's very difficult to remember them. So this Twitter user actually said, I'll give the latest subvariant its own name and called it Centaurus. No? Pero kailangan pa rin natin to be a little bit familiar with this because this is how the news would go and the stories and how we will read literature about COVID-19. So, may tinatawag na variants of concern. And the previously circulating variants of concern, nadaanan na natin to last year, were the alpha, the beta, the gamma, and the delta. The delta was the one that led to a lot of deaths. We saw in the news, di ba, yan yung napupuno yung mga emergency rooms and hospitals. People were forced to stay at home and be treated at home because of the overwhelming use of our hospital beds. Pero buti na lang we've been able to overcome this kind of challenge, but we still have this currently circulating variants of concern or the VOX, no? And that's mainly the Omicron. The first cases of Omicron were identified towards the latter part of last year. So, no mga Christmas season, di ba, may mga cases na tayo of Omicron. And yung variant, nagkaroon ng subvariant. So, these are mutations of mutations. No? So, the current Omicron subvariants that the WHO keeps an eye on are the BA.4, 0.5, tapos nadaanan na rin natin yung 0.2. Okay? And in this table, I tried to just put all of us in proper context when we first heard about them. So the BA.4 and 0.5 were actually first seen already in January of 2022. Pero during that time here in the Philippines, nasa 0.2 pa lang tayo. And months later, that was the time we started to feel the impact, the impact of the entry of 0.4 and 0.5 to our country. So meron ganyan mga news items that you would hear. Sometimes it's good to read them and sometimes it's just good to listen to them. So in the Philippines, we've had our own surges. No? So yung alpha, yung beta, tapos yung pinakahuli dito was the delta and then the Omicron. Yeah. And it almost felt like hindi pa tayo over this. But the January peaked so fast and then started to go down again. And then came the subvariants. Yeah. So the very first Omicrons we heard about was the 0.1, 0.1, 0.529. Yan na nga yung Omicron. What? So just that we know that the Omicron subvariant started to be more transmissible. Buti na lang nga hindi sila masyadong particularly prone to increasing our hospitalization rates and deaths. Maybe because at the same time, most of us were already vaccinated. And over the course of the months, we've seen the subvariants happening. So there's unique mutations that happen with the point 1, naging point 2, tapos nagiging sister lineages of point 4 and point 5. So if you want to be technical, I included this particularly heavy table, just that for some of us who might be physicians or PhD students or just want to hear about technical aspects of the subvariants, this is how it looks like when they describe it in terms of lineages and genetic material. Okay. But then again, just like another day ago, August 7, there's a new subvariant again that the CDC is tracking in the United States, and it's 0.4.6. So we'll just have to wait what happens to this particular SARS-CoV-2 and how it will affect citizens of the United States, other countries, and then whether it will eventually reach our shores here in the Philippines. But the main question, of course, that comes up with us with all of these variants that's happening, how effective are the COVID-19 vaccines against the Omicron? So parang ano ba to? Dating lang sila ng dating, and how are we in terms of vaccination? The ones that we received last year, are they still protecting us from all of these new variants? So the latest data that has actually been released just this year show that for people who have received booster vaccines on top of their primary series, show that very good, up to 90 to 95% ang protection, ang effectiveness ng vaccines. So it looks very, very encouraging. Okay, so you would see here that the dots of the effectiveness, which is on the y-axis, would reach very high numbers, very close already to 100%. So that's very good. So some more details, okay? So what's the vaccine effectiveness of the primary series plus booster against the Omicron? So if you look at this very, very complex tabulation and graphical representation, it tries to just in one look tell us that most of the vaccines that we have been using and actually available in our country are actually effective when they started to measure vaccine effectiveness. So yung mga gray dots here are the primary series. Tapos, di ba, most of us receive primary series. Tapos, iba yung na-receive natin na booster. So, the different colors are the booster doses. So, in the very, very first column of squares here, the AstraZeneca, yung primary series, maybe most of us receive AstraZeneca, and then receive Moderna, yun yung pink dots, as booster dose. And you would see na the effectiveness again started to reach very high numbers kung during the first time na they were vaccinated with the primary series. So first dose, second dose of the AstraZeneca, nasa mga 55 to 70%. But then after the booster, the effectiveness went up to somewhere between 90 to 95%. And the same is true for the other vaccines. So yung naka-receive ng one dose of Janssen, tapos yung next doses, yung next here, the Moderna, you would see na pwedeng yung first primary series of Moderna received by some of us maybe, especially those in the private sector. The vaccine effectiveness here was somewhere between 50 to 80%. But again, yung booster, perfect talaga yung term na booster kasi parang na-boost niya talaga. So people who have received 2 doses of Moderna plus the booster Moderna showed na the effectiveness went up a little bit more. And the same with Pfizer, no? So very high Pfizer to begin with, and then additionally high again after the boosters. Yung Sinovac, that's the last here in this particular picture. So the effectiveness shown in the gray dots were somewhere between 50 to 60%. But again, after receiving Pfizer booster doses, yun yung blue dots, the effectiveness went up. So parang talagang kailangan ng booster. On top of the primary series, don't stop just on the first 2 doses you've received, especially if you received them before circa 2021. Dapat may booster doses na kayo ngayon. And the ones that are preferred or recommended are the mRNA vaccines or either Moderna or Pfizer. Okay. Definitely in this next group of graphs, it protects us from severe disease. Di na nga tayo na hospitalized, no? Our experience during the Omicron variant surge in January, when the patients were coming in the hundreds to the thousands, they didn't have to be hospitalized. So the vaccines seem to have protected us from severe disease. And there's also, di ba, in the past sinasabi, kasi COVID-19 ka pa rin, but the boosters apparently had benefit also in reducing symptomatic disease. So hindi ka na masyadong sick, hindi na mahaba yung fever, hindi na mahaba yung cough, hindi na sobra-sobra yung nararamdaman nating quote-unquote flu-like illness. So there's some reduction in symptomatic disease. And actually, even for any kind of infection, whether symptomatic or asymptomatic, there's more evidence now that with the booster doses, the pink here is Moderna and the blue here is Pfizer, there's effectiveness in reducing the rates. So I hope I'm trying to convince you na there's also some more science showing, ito kasing T-cell response, hirap nito i-measure eh. Actually, there's no definite recommended correlates yet. Ibig sabihin, pag inisip mo, paano ko ba may-measure yung T-cell response? It's very hard to quantify. But there's some initial findings that if you do measure this IGRA, interferon gamma release assays using these kinds of cells, there's some evidence that it seems to increase after vaccination. Sorry, I sort of spoke in a very scientific way, or in a very technical way. But when we describe immune response, so pag nabakunahan ako, ang immune response ko pwedeng tinatawag na B-cell or T-cell parts to ng immune system natin. And the T-cell response is sometimes difficult to measure. Yung B-cell, di ba naririnig natin, meron tayong mga kababayan, they go to certain laboratories and get their antibody levels measured. That's a way of measuring B-cell response. Kasi yung B-cell, yung gumagawa ng antibodies. Pero itong T-cell, hirap nito i-measure. No? But there's some scientists already who started to show that there's some correlation. Okay. So it seems like there is already to some degree, I can say quite confidently na there's already solid science in the benefit of the first booster. So dapat lahat tayo, after the primary series, dapat we go ahead and proceed with the first booster. Now, what about the second booster? And so our FDA started to approve the implementation of a round of second booster among healthcare workers, the elderly, and those with comorbidities. And that's because of the experience with the first booster improving immune response. So if you fall under these categories, yung older patients, more than 50 years old, maraming illnesses, maraming underlying conditions that may make you prone to more severe forms of COVID-19, please go ahead and line up for the second booster. Who are eligible? Ito, so persons who are more than 50 years old, yung dito sa Philippines, we call it A2, saka A3, those with some immunocompromised states. And healthcare workers are also eligible for the second booster dose. Okay, which vaccine and when? So the ones that are recommended for the second boosters are the mRNA vaccines, which include yung BNT162b2, which is the Pfizer vaccine, and the Moderna vaccine. And it's recommended that we wait for at least 4 months. So ibig sabihin, kung January yung first booster mo, dapat February, March, April, May, dapat June pumipila ka na. Okay? At least 4 months between the first and the second booster. Okay, so it's very solid already, the science behind the observation that vaccines may be the key to end the COVID-19 pandemic. And even with the occurrence of Omicron variants and subvariants, it seems to show what I've showed you so far is that these vaccines, particularly receiving the booster doses, are important and protective for all of us, okay, even against the new variants. Kaya lang, this is the Department of Health vaccination dashboard. So it says here, depending on where you are, maybe some of you are frontliners. Some of you listening to us right now may belong to A2, A3, A4, maybe A5, maybe B and C. Pero kita nyo, yung nagpapa-booster, konti lang. No? So if we've already achieved 23 million people receiving or more, no? Konti lang panay konti lang yung mga nakaka-receive ng booster doses. So what else ba yung pwede namin idagdag dun sa so far what I've said so far? What else may have been left unsaid? So I draw some of the next few slides from the website of UNICEF and CDC and some also from the WHO. Kasi baka meron kaming hindi pa nasasabi, no? Some of you like listening to podcasts. And I'd like to refer you to this UNICEF website kasi it tries to explain the vaccines in a way na baka kung paano nyo gusto pakinggan. Are you a PhD student? Are you an expert? Are you a parent? Are you a child? Are you a lay person? Baka iba-iba kasi yung way to explain. And I'm going to try to navigate you through different levels of how to approach vaccines, no? Just in case you still have some doubts about them. Pero I'd like to refer you talaga to reliable, trustworthy sites like the CDC. Pwede kayo dumiretso dito sa page na to answer some of your FAQs, clinical questions. And the UNICEF also has a really nice website and a page that has very, very specific questions. Pero if some of this, kasi parang ito yung mga questions last year na na-answer. But if these are your concerns, please chat or type it in the Q&A and we'll go over them. There are also many studies looking at bakit nga ba hindi pa nagpapabakuna yung matatanda at saka ito, yung mga they call this group millennials, 18 to 39 years old. And actually, some people think, sabi nila, most of the people are concerned about side effects, so we'll try to answer them. Many people who remain unvaccinated, sabi nila, lalo na tong group na 18 to 39, parang feeling kasi nila, napakalakas nila, napaka-healthy nila, and they will never get COVID-19. Some still doubt efficacy of the vaccine, some worry about side effects, and some really are anxious because the vaccines were developed very fast. So let me help you answer some of these concerns. No? So meron talagang at greater risk for COVID-19. If you are otherwise healthy, maybe talagang hindi kayo at greatest risk, pero meron pa ring risk. Okay. But those at greatest risk are those who are persons with prolonged, unprotected close contact. So, magkasama kayo sa isang room, hindi kayo nakamask kasi kala nyo walang COVID isa't isa, di ba? So, these are the ones who are at greater risk for getting COVID-19. People living in congregate settings like sa isang condominium, sa isang dorm, yan. Minsan nga, kung nasa carpool kayo, parang congregate setting rin yun. Kasi if one of you have COVID-19, then the entire group will have COVID-19. But the ones we'd really like to protect are those who are at risk for severe COVID-19. Okay? And these are, sinabi na natin kanina, yung A2, A3. Those who are older and those with a lot of medical conditions that make them at risk for worse outcomes. How long does protection of COVID-19 vaccines last? So, research is still going on kasi, di ba, nabakunahan naman tayo for maybe at most 1.5 years by now. But most people will have strong protection against serious illness and death for at least 6 months. Kaya nagbo-booster doses. Yung mga side effects, one of the side effects that many people pala are afraid of is whether COVID-19 affects fertility. So the answer there of UNICEF, CDC, WHO, yan, and all the other studies is that no, false claim to on social media. So isa to sa mga major misconception and should be corrected. No? If you are trying to get pregnant, it's best that you are vaccinated. So there's this data that came out recently from Prasad et al. Ang fear pala ng mga many of yung umikot sa social media is that the SARS-CoV-2 spike protein, which is part of the many component of many of the vaccines for COVID-19. Akala nila sounds the same as the syncytin protein, which is essential for placenta formation. And that's why there was a doubt that being vaccinated will lead to fertility. But studies have shown that there's no magkaiba sila na protein. No? Hindi sila even cross-reactive to each other. So getting vaccinated has nothing to do with any kind of antibody related to the syncytin-1 protein important for fertility. So it's a misconception. Okay. And one of the reasons why it's important for people, women, mothers who are planning to get pregnant, to get vaccinated. Kasi they've also seen na pagka buntis ka, tapos nagka-COVID ka, there seems to be an increased rate of stillbirth, so poor outcome of the pregnancy, or the need to terminate the pregnancy at a preterm. So mas mabuti mag-ingat in addition to everything else na ginagawa nyo during pregnancy. It's good to consider vaccination. Okay. Tapos, about children, pwede na ba talaga bakunahan yung mga bata? So, parang hindi na to bago. Even our FDA has approved vaccination for our children. So Pfizer and Moderna vaccines are already available worldwide and approved. And here in our country, it's also approved for the use of for children less than 18 years old. Tapos, meron ding mga hesitation from certain groups na either sobrang payat or on the bigger side, heavyweight. Ako, mas mataas than recommended BMI. So I fall under this. Minsan iniisip natin hindi mahalaga, but they've seen this came out just this month, first week of August this year, na mahalaga pala magpa-booster, no? So there's increased hospitalization. So the BMI, yung x-axis niya sa baba. So the bigger the BMI, that's the index, no? The higher it is, the heavier you are. There's increased hospitalization rates and severe disease as you get heavier. But it seems to also be protected. May protection yung third dose ng vaccine. No? Parang nata-taper down. So prior to the giving of the booster doses before, parang ang taas, pero now there's hope. In addition to all of us trying to lose weight also, it's also good to understand that people at risk for severe COVID include those who are obese. Okay. Yan. Tapos yun nga, just going back to pregnancy, it's seen to be safe even during pregnancy. So, is it safe to give vaccines, the COVID-19 vaccines during pregnancy? So, inobserve nila yung mga mothers who get the vaccines, and they've seen that these are safe. No? So, yung mga adverse events, they're the same for those who received the vaccines tsaka didn't receive the vaccines. And what's best for pregnant women? Medyo bias kasi ito kasi most of the studies looked at mRNA kasi yung mga studies occurred in countries that use mRNA heavily. So right now, the evidence showed that the safety net for COVID-19 vaccines for pregnancy, ang may data pa lang are the mRNA. Kaya yun yung recommended. But there are studies going on to just assess the safety also of the other brands of COVID-19 vaccines. How can I protect my family until we are all vaccinated? Kung naghihintay pa yung other family members to get convinced. So it's important to continue wearing our usual protection. So wear the mask, physical distancing, good ventilation, open the windows for outdoor scenes. No? Kung kakain kayo, al fresco dining. Wash your hands regularly, and if somebody is sick in the family, seek consultation and isolate. Ngayon, just a little bit more on COVID. And I think this is important, yung long COVID. Ako kasi, feeling ko, kung parang sabihin sa akin na, kasi mabilis lang naman yung COVID, sipon-sipon, sore throat lang yan. So, ba't kailangan magpabakuna? Kasi merong threat or risk for long COVID. And believe me, you don't want to have long COVID. So it was only in October of last year that finally WHO gave a standard definition for ano ba yung long COVID. Kasi matagal na natin naririnig yung term na long COVID. But it's sort of, basta hindi ka gumagaling. Yun, ganun. So this occurs in individuals who have confirmed or probable. Yung iba kasi hindi sila sure pero sounds like COVID. So you can also label them as long COVID. This should, ibig sabihin, 3 months na ka na-diagnose na may COVID, tapos hindi ka pa rin 100% back to usual. So it requires 3 months after the onset of COVID-19 and at least 2 months that you're feeling the symptom. and there's no alternative diagnosis. And the most common symptoms are fatigue, shortness of breath, and cognitive function. So let me talk about that a little bit more. No? So sabi, yung long COVID based on many kinds of longitudinal series. So di ba ngayon nagki-clinic na tayo. We're monitoring people who have had COVID. Yun nga, there's this group of people that actually never get better. So there may be 1.2% of young people and maybe as much as 4.8% of older people, yung 60 years and older. Tapos ang mga parang nalilink pero hindi pa very solid yung association, yung older age, overweight or obese, number 3, asthma, number 4, being female, and number 5, prior physical or mental ill health. Ibig sabihin, hindi ka naman 100% okay before. Okay? So, when some of the people, experts were asked, pwede nyo ba explain a little bit more what long COVID means? So, number 1, fatigue. Yung parang pagod ka panay. Hindi ka, parang kahit nakatulog ka, hindi ka feeling fresh pagising mo sa umaga. Meron kang feeling of tiredness. That's the number 1 most common symptom long COVID patients or long haul COVID patients would tell you. Number 2, shortness of breath or trouble breathing. Ibig sabihin, dati nakakaakyat ka ng 3 flights of step. Ngayon, naglakad ka lang, hingal ka na. So you are more limited. Dati nakakatakbo ka ng 1 kilometer. Ngayon, 200 meters, hingal na hingal ka na. So there's some shortness of breath. This has to do with the changes in the chest and the lungs during the acute COVID. If you're in particular kinds of hobbies, sports, occupations, baka this is important for you. So I've seen patients who are divers or marathon runners, they can't get back to their love of their lives. No? Hindi nila magawa ulit kasi they started feeling short of breath. Okay. Number 3, most common, yung sabi nila, quote-unquote, brain fog. So, cognitive dysfunction. Di ka makaisip ng maayos. You're speaking in front, you're a teacher, tapos you're groping for words. Lack of attention, di ka makakoncentrate. Difficult to recall. Alam mo yung pangalan nila before, pero ngayon di mo na maalala. You have trouble sleeping, or let's say you're an executive in the office, tapos hindi mo na maalala yung mga staff mo. So this is called brain fog. And I've seen this and heard about people complaining of this. This is number 3 most common symptoms. And supposedly there are maybe 200 more symptoms. Yung iba nga back pain, yung mga ganun, medyo odd na, but the more data that comes in, the more they've been seeing it as part of post-COVID or long COVID. Tapos hindi naman to frequently asked question, pero paminsan-minsan lumalabas. So people would every so often ask about, is there new evidence about ivermectin? So let me go back to slides that we've shown before during the PCP annual convention, but this was updated recently last month, July 14, 2020. So remember, meron pa ring non-severe, severe, tsaka critical. No? So let's look at the interventions that have been seen to work. So dito nakikita nyo yung strong recommendations in favor. So meron steroids, baricitinib, molnupiravir, di ba naririnig na natin yan? Ito na yung prescribe ng mga doctors. Paxlovid or yung combination nirmatrelvir plus ritonavir, of course remdesivir, and many other monoclonal antibody combinations. So where does ivermectin belong here? So it belongs to recommendations against. Now, remember, meron na tayong, although before, di pa tayo sure. They were either under studies, researches, trials, yung iba, observations, retrospective cohort studies, yan. So, they've seen that either strong or weak recommendations, pero lahat to again. So, let's not keep on like harping in the past, no? Let's stop using them because they've been seen to either have a lot of adverse reactions or no benefit at all. Okay. Finally, for the last 3 minutes, let me just describe to you what we've been doing in the Philippine COVID-19 vaccine effectiveness study. This is our study here in the University of the Philippines, and we're trying to estimate the effectiveness of COVID-19 vaccines in our country. So yung unang tanong, vaccine or no vaccine? Tapos yung first site kasi natin sa PGH, no? Di ko pa, interim pa kasi kino-compute pa ng statistician yung actual vaccine effectiveness. But let me share with you our immunosurveillance results. Ito yung sinabi natin kanina na nagme-measure ng antibody response. Okay. So, before the vaccination rolled out, we already did antibody levels for almost more than 50% of our staff. And we've seen na marami pa yung non-reactive, never had COVID-19 despite us being a COVID referral center for more than a year. No? So ito yung parang baseline namin. Merong mga nagka-COVID, ito yung 11%. Meron naman na hindi nagka-COVID pero parang merong proof na nagka-COVID sila. Tapos meron din nagka-COVID na wala ng antibody. So we started measuring antibodies for volunteers after receiving the vaccine. So this is how unvaccinated healthcare workers will look like, no? So yung mini-measure, yung orange bar, ito yung dami ng antibodies that you have. During that time, our max number was 250 units. So we've seen na kung unvaccinated ka, usually halos wala siya. Yung little blue rectangle sa baba, halos zero, no? Pero kung orange, siya yung nagka-COVID na noon, nagka-natural COVID. So yung antibodies niya, yung IgG, is from a natural reaction, natural illness. No? Pwede kasing ganun nagka-antibody ka dahil either nabakunahan ka or dahil nagkasakit ka. Di ba ganun rin pag tigdas? Pwedeng positive yung IgG mo kasi either nabakunahan ka for measles or nagka-measles ka talaga. So here's how the first series, no, yung unang series, yung dose 1 and dose 2, and then we started measuring antibody levels. So kung never ka nagka-COVID, tumataas yung numbers mo almost hanggang mga 2,000. Tapos over time, after 2 weeks, 4 weeks, 6 weeks, 8 weeks yan, kita nyo bumababa. And that's a very different response from those who had COVID. So yung mga nagka-COVID illness, tapos nabakunahan pa sila, yan yung parang maganda. They stayed higher for long periods of time, longer periods of time. Kung Sinovac, there's a small rise in the antibody levels. Pero again, kung nagka-COVID ka na before, ito yung orange, parang maganda rin yung response, no? And this is compared to Astra na parang mas mataas yung antibody levels, tapos mas mataas lalo kung combination, ang tawag dito hybrid immunity. Nagka-COVID ka at saka nagka-bakuna ka. Okay. And then we started looking at different brands. So you see na yung mga naka-receive na Moderna, magaganda talaga yung antibody levels. Yung naka-receive ng other brands are a little bit low. Tapos, whether 50 or older ka, parang no difference. The same yung trends, no? Kung more than 50, tsaka less than 50. Tsaka dun sa data set natin, parang ganun yung nakita namin. Although, healthcare workers to so mas konti lang talaga yung matatandang staff. And there was no difference dun sa more than 50 and less than 50 for Sinovac as well. What about male and female? Ganito yung picture ng mga male, matataas as over time bumababa, no? Ganun din sa female. The same for AstraZeneca and Sinovac. And then, syempre, nandun na. So, anong gagawin natin? Bumaba na yung mga levels ng mga people, no? After 6 months. So, the next question was, booster ka ba o no booster? So, parang definitely there was the answer to vaccine or no vaccine is yes, vaccine. And the question to booster or no booster, let's see, no? So here we already were measuring neutralizing antibody test. And you see na nung nabakunahan ng booster, ayan na naman yung Pfizer, so yung mga nagka-Astra, kasi predominantly Astra and Sinovac dito sa PGH, tumaas pero again bumaba after 4 months. No? Similar also for those who had yung hybrid COVID in the past. No? And that's why we also convince our staff na kita nyo, tumaas na protect tayo during the Omicron surge, pero it's time for our second boosters. So I think the message here is regardless of what your primary series was before, don't fret kung mababa yung itsura ng mga antibody levels ng Sinovac compared to Astra. It doesn't matter, basta magpa-booster tayo kasi the boosters of the mRNA really increase the level of immunity. And then we're now measuring the T-cell response. Finally, ang last kong sasabihin, dun sa mga, kasi isang frequently asked question yun yung paano kung nagka-COVID na ako, kailangan ko ba magpabakuna? And we saw na yung mga orange bars kanina, panay siya mas mataas, no? Kasi nga, the natural infection gave you some antibodies, pero the natural infection of COVID plus boost it with the vaccine really make you very, very strong and protected against COVID-19. So, just in case you want more, you have more questions, you can chat it here, or if you just like listening to podcasts, I would like to refer you to really reliable websites like the Scientific American here and the WHO. Kung gusto nyo makinig, mga 2-minute, 3-minute, minsan 5-minute, dami nyo na napipick up. Okay, meron talagang mga vaccine refusers or vaccine hesitants, no? So, ang suggestion ko lang, huwag tayo makipag-away sa kanila. Let's just try to listen to them and understand them and maybe try to convince them. So, there's this book by Dr. Hotez, I quote, kasi sabi niya, during our lifetime, we're caught in all of this, a lot of conflicts and disagreements, and one of them is about anti-vaccine movements. But now, during the pandemic, it's really time that we elevate the role of science, but we also need to be very diplomatic. So let's just do this in a spirit of collaboration. Huwag tayo makipag-away, huwag tayo magsiraan. In social media, let's try to really just correct in a very diplomatic manner misinformation. Don't spread misinformation and just try to get everybody in a healthier state. Okay, in summary, I hope I help you understand that our current COVID vaccines protect us even against the circulating variants of concern. They have been shown repeatedly to reduce hospitalization, severe COVID, and death. And finally, let's keep ourselves informed using reliable and trustworthy sources of information, including the Philippine College of Physicians. Okay, thank you very much, everybody, and we welcome questions now.
Okay, medyo marami na tayong questions sa ating Q&A box. First off, Doktora, may dapat ba ika-alarma ang mga vaccinated individuals if they get COVID? Do they have to worry about the possibility of vaccinated individuals having long COVID?
Ibig sabihin para, okay. Kung long COVID, actually I think yun talaga, ako personally yun talaga yung parang ayaw ko mangyari, magkaroon ng long COVID. And unfortunately, even if there seems to be some associations already being seen, di mo talaga ma-predict who gets COVID, long COVID, and who just gets like 2 days of sore throat. So I don't think meron tayong enough data to tell you, our audience, na pag na-vaccinate at nagka-COVID ka, hindi ka magkaka-long haul COVID. Pero definitely, I think the risks is lower. Yun yung na-achieve po nung vaccines. It reduces our risk for COVID-19. And that risk reduces the risk for long COVID. Pero I think baka ang question din, nagiging increase ba yung risk mo for long COVID kasi na-vaccinate ka? Walang ganong association or observed trend. Hindi siya ever lumabas.
Okay. Again, from Mr. Red Mendoza, is it right for the public to be alarmed sa emergence of BA 2.75 because of its probability to be more transmissible? Mas severe din po ba ang presentation niya?
So yung lahat ng Omicrons so far, mas transmissible siya. Kaya siya talagang niwa-watch very closely ng WHO kasi parang inherently the mutations allow them to be more transmissible from the very first Omicron .1. So, pero fortunately, whether it's because of the virus itself na hindi siya as deadly, hindi siya as potent, or is it because marami na kasing vaccinated kaya hindi na ganun ka-severe yung presentation? So it's this mix of good things, characteristic ng virus at saka characteristic ng population at risk that makes us a little bit in a better position now than during the Delta.
Definitely. Ito, interesting question. With the recent news about expiring vaccines that are being discarded, would you recommend that second booster dose be recommended to all adults regardless of age and presence of comorbidities?
Marami kasi, okay. Kasi even if I actually I advocate talaga the use of vaccines, I also know that hindi naman siya perfectly walang potential harm. So I would still follow the science that's available to us, and I would still wait for more data to say that the fourth dose is as safe as the fourth dose is safe. Na walang question. Na parang kung i-weigh mo yung odds pa, mas beneficial pa rin to receive the fourth dose even if you don't have comorbidities. Wala pa kasi tayo sa state na ganun eh. Kaya baka I won't. Parang I know there's a lot of potential wastage that will happen. But of course, ayaw rin natin na magkaroon ng unnecessary adverse events among people who probably won't benefit kasi. Ngayon kasi yung science, nakikita natin may benefit talaga kung bigyan mo itong mga populations at risk. Pero kung otherwise healthy, baka enough na kasi yung 3 doses. Na-boost na yung T-cell natin eh.
Oh, okay. Ito naman po, if the primary vaccine, meaning primary series 2 doses given, then after 1 year has passed, is it still considered a booster if another dose of vaccine is given? I think ang tanong niya, uulit ba ako ng primary series kasi 1 year na?
Oo. Booster pa rin ang tawag doon. Kasi yung body natin, yun nga eh, merong B cell tsaka T cell, tapos may memory cells po sila eh. So, hindi naman start from scratch. Pero wag ka na maghintay ng 1 year. Magpabakuna na po kayo.
Yes. Okay. Are minor procedures like intra-articular steroid injection contraindicated in patients who have recently had COVID booster? Parang di ko po narinig itong concern na ito.
Parang hindi po. Oo. Kaya intra-articular injections po kasi parang very local po yun eh. That's an intervention. Dun po sa mga nakikinig, minsan kasi masakit talaga yung kasukasuhan mo, pero sasabihin ng rheumatologist, wag tayo uminom ng iniinom na steroids kasi that will affect the whole body. So better po injection na lang kita para yun lang yung affected part. So it's not a contraindication.
Na-mention niyo po sa slide niyo kanina that if you recently had an infection, you'll wait a little bit longer to get the booster vaccine. How much longer do we need to wait?
You mean yung COVID-19? Kung nagka-COVID. So yung nagka-COVID kasi, in some way or form, meron pa ring some problem with access and equity. So parang ibig sabihin, kung ako nagka-COVID, I sort of have like 3 months na parang mataas pa yung antibody level ko. Hindi ako magmamadaling pumila sa LGU para magkabakuna ulit. I have that option to wait for maybe 2 weeks, 4 weeks that I'm much better and over my acute COVID-19.
But there's no clinical contraindication. Dati po kasi parang as soon as you get out of isolation, you can have yourself vaccinated already.
Walang contraindication. Hindi ka biglang hihimatayin doon, hindi. Walang ganon. It's just the thought na baka you'll feel better, you're able to cope with the fever, di ba? Nagkaka-fever kasi o sumasakit yung braso mo. You'll be able to cope better with it pag mas magaling ka na talaga. Naka-recover ka na fully.
Okay. When can we expect locally a vaccine for the newer variants?
Pinag-uusapan na po sila. Actually, sa US, they said something like September, maybe the newly concocted vaccines will be available. So, usually tayo, mag-observe tayo for a few months, tapos we'll wait for our own FDA to approve it. We usually, parang ganun yung usual. So, at saka, of course, when they produce, the country who produce it will initially produce for their citizens usually. So, yan. So, may konting lag. But maybe sometime this year, end of this year, or for the Philippines, maybe sometime next year.
Okay. Are there any precautions, one with persistent positive RT-PCR but high CT, which is cycle threshold for the others who don't know, should take after the 7-day isolation? Any precautions po, kahit positive pero high cycle threshold?
Oo. So, pagka, you mean mga 37, 38, 39, una, dapat hindi na tayo nagpapa-RT-PCR ulit eh. Kasi get nga to that situation na parang di kita ma-clear kasi meron kang positive PCR test. So, ang solution lang doon is to just stay isolated and wear your mask all the time. Kung in certain facilities like hospitals, minsan may ganun eh, or you're in a very important, walang makapalit sa'yo na position, pwede ka naman i-clear ng infectious disease person or your physician, depends. So, but you need to keep on like wearing your mask.
Isa pa pong palagi nangyayari, nag-positive na sila sa antigen and they keep testing and then they'll show you that they turned out negative. Ano po ba ang recommendation sa repeat testing for antigen?
Oo. Ako rin hindi ko po yung ginagawa eh kasi yung antigen test talagang nagiging negative yan. Pwede yan maging negative the day after you are positive, di ba? Kasi it's a different kind of test. It's a different kind of test compared to PCR test. So pag nag-positive ka with symptoms, more or less talagang positive ka. And your being negative with antigen does not make you not infectious anymore to others. So you still need to finish kung ano yung period of time recommended for the kind of COVID you had. So if you belong to the severe to critical, you still have to finish 21 days. Oo. Yan. Pag moderate, di ba, you still have to finish 10 days. Pagka mild, you still have to finish 7 days. Kahit na on day 2, nag-antigen negative ka na. Yun. That's why it's not recommended to repeat it.
Okay. I was just vaccinated po last Saturday of second dose Hepa B. Okay lang po ba magpa-vaccine ng COVID booster kahit hindi pa po tapos? Ano pong hindi pa tapos?
Baka nag-umpisa siya ng, di ba 3 doses kasi Hep B?
Yeah.
Baka that's what it means. Pwede po, pwede po. No
Okay,
problem.
Our
Kaya
LGU
lang
is...
baka kasi yung ibang LGU, may kanya-kanya silang rules eh.
Yeah, correct.
Although sa WHO and CDC, it's not contraindicated. You can argue with them, kaya lang in the end, it's the LGU policies that will prevail. So check nyo na lang.
But generally, kahit po sa ibang vaccine, right? Pati sa flu or ano pwede. Our LGU is already giving second booster or fourth dose to general population 18 years old and up. If not yet recommended, how come the LGUs give the second booster to general population?
Hindi ko po alam.
Hindi rin. Okay. After second booster, ito naman...
miscommunicate lang.
Ito naman po excited. After second booster, when na po ulit magpa-COVID vaccine?
Okay. So wait and see tayo. We'll have to wait and see what happens to the pandemic. What's the next strategy of the SARS-CoV-2? Parang ganun eh. We're trying to outsmart the SARS-CoV-2 pero it ends up na-outsmart niya tayo. So yeah, it's a wait and see game.
Okay. Baka lang po na-miss niya yung slide niyo kanina. What is the PCP stand on ivermectin?
Oo, hindi siya. So we listen to the science and we listen to the available published literature, and so far it says recommendation against the use of ivermectin except for researches. Yun lang po yung parang ina-allow or nire-recommend right now.
Okay. Iba po medyo lang, may sentiment sila. What do we do with the anti-vaxxers? Are we just going to tolerate them?
Oo, kasi alam nyo, sayang lang oras nyo. Tsaka yung pagod, tsaka yung emotions nyo. So, hayaan nyo na lang sila.
Common question po ito. Okay, common question po ito. If I had a choice, what brand of booster po ang pipiliin ko?
If you have a choice, well, usually ang choices lang naman either Pfizer or Moderna. Yun po talaga yung recommended. So, kung ang first booster nyo ay, let's say, Moderna, tapos you didn't feel any bad effect on it, hindi kayo sobrang nanghina, then go with Moderna again. So, either one is okay. Kung ano available sa LG.
Okay, I think natanong ko na po lahat. May isa pang text-in question sa akin. Okay, for those 2 times boosted and still got COVID after, should they get another COVID booster after recovering? Parang hindi pa siya na-discuss.
Hindi, pero sobrang strong na po. Di ba sabi natin yung hybrid immunity kanina, yung one of my last slides. Maganda po yun. Not to say naman na magpa-COVID na kayo, nag-COVID-19 kasi ayaw mo nga talaga magka-long haul. But in the event you did get COVID in a natural way. So you have natural immunity. Tapos magpabakuna po. Kung naka 2 doses kayo, stop na muna at this time until we have new data to say that there's another dose that will benefit you. So for now, ano lang, chill lang. You have enough, you have evoked enough immune response in your system to keep you strong po. I'm sure even if you had COVID, hindi po siya severe COVID.
Okay, from FB Live, Tristan Custodio, what are the effects of an expired COVID vaccine?
Dapat wag po natin gamitin yung expired. Expired, parang meron po kasing nire-redate sila eh. Kasi there's a science and a math to it na hindi ko actually alam. Pero they've shown na yung nire-redate nila is according to some computation they have. Pero yung totoong expired, wag na natin yun talaga gamitin.
Okay, there's a question here. Kung nagka-COVID na po ako at nagka 2 boosters na, ilang days po ba ang quarantine ko?
So nagka-COVID ka ngayon. So ganun po, kung mild, 7. Kung tinawag kayong mild COVID, 7 days. Kung moderate po, 10 days. Kung severe, 21 days. Ganun pa rin po.
Okay. I think naubos na natin yung mga tanong. To summarize lang, Doktora, summarize the COVID variants of concern na lumipas over the past 2 years. And she reiterated that the primary series still protected us versus the severe disease, but we still need the booster shots for us to increase our levels of antibodies. Ang ganda ng effect niya after getting boosted, and it's safe in pregnant women. It will not cause infertility. And she also discussed long COVID. So kung nagka-COVID kayo, may konti pang hingal, pagod, and parang medyo mas mabagal yung thought processing. Those are long COVID symptoms. And we should get our facts from reliable sites like WHO, CDC, UNICEF, and try to listen to more reliable podcasts or other sources of information. May iba pa po ba kayong final words, Doktora?
So ano lang, magandang we keep ourselves posted with up-to-date information. So here in the Philippines, I think very good po yung DOH websites natin at saka yung mga town hall meetings, mga webinars that they sponsor, as well as of course the Philippine College of Physicians at saka the other professional societies including the PISMID. Let's keep ourselves updated para we're not part of the misinformation campaign.
Yes, agree. And to give us the closing remarks for this PCP Health Forum, let's welcome our regent, Dr. Juan Maria Ibaraco.
Good morning. On behalf of the Board of Regents of the Philippine College of Physicians, we are very grateful to Dr. Regina Burba for the extensive discussion on COVID-19 variants and the importance of vaccinations. The PCP remains true to its commitment to providing scientific health information to the public in a timely manner, and we hope that you will all be our partners in spreading accurate and correct information to all Filipinos. We thank Dr. Gwen D. Agra for moderating this health forum and commend the Committee on Media Communications for hosting this activity. We hope to see you again in our next health forum. Be safe and stay healthy. Good morning.
Again, maraming salamat po, Dr. Burba. You have been so reassuring. You have given us so many facts na talagang na-reassure kami, na-enlighten kami. And we would like to thank the public for joining us, and you can still give comments or write down your questions in our social media pages, Facebook, YouTube. You can find us also on Twitter and Instagram. So you can also email us sa PCP. Hanapin nyo lang po kami sa Facebook. And our next forum will be on tuberculosis. So watch out for that. Ano pa rin po, isa pa rin siyang major health problem sa Pilipinas. Again, maraming salamat po sa lahat. Thank you po, Dr. Berba. Sa susunod po ulit, I'm sure you will again be guesting with us kasi napaka ganda nyo pong mag-impart ng knowledge sa ating and join in our next PCP Health Forum. Take care and stay safe.
Thank you, Dr. Gwen.
The Philippine College of Physicians, through the Committee on Media Communication and Health Forum, wishes to thank its media partners, social media followers, and participants. See you again next time, here on the PCP Health Forum.